you have had that pain in the left shoulder for how many years? When did it start to cause immobility and severe pain, and so that you could not
Probably
work?
about 5 years ago.
5 years ago. And you work as a
Letter carrier for
letter
the Postal
carrier.
Service. Yes.
And so you've used that arm for 40 years now. About. And so it's just been kind of like getting you, and did you injure it in any way that you know?
There's been times where I've tripped and fallen on it, or on my elbow, and it's jammed it, and it's
Okay.
so there have been a few times where yes, it's hurt for a few days, a little bit more, and
So when you first came in, what was the mobility of the arm? Show me kind of like what you could do and what you could not do.
I think some of the biggest challenges I had would be if I reached far away, the pain would be so severe that I could not grasp anything.
Okay. So you
And
lost
then
strength of your hand as
strength of my hand,
as you moved
especially,
out.
yeah.
Yeah.
And I've learned to put my belt on differently. I'm left-handed, so a wallet in the pocket sometimes hurts reaching for that, brushing my hair. All those little things I would have to tend to be careful with.
Right. And I think you saw several shoulder specialists. Is that correct?
Yes, and I've had cortisone shots, and I've nursed it for quite a few years that way, but then they just stopped working.
Yeah. And what did they say about your shoulder? They said basically if we were going to do something, we have to kind of replace it. Is that what they were?
They definitely said you need a replacement,
You need a replacement. Okay.
and you'll let us know when the pain is so severe that we can give you one.
Okay.
That's how my last doctor was, and I just went, okay, then I'll nurse it as long as I can.
And then you came and you saw me, and I discussed with you the use of radiation in the treatment of osteoarthritis of the shoulder.
Correct.
And we started treatment approximately a week and a half ago, maybe.
Correct.
And in a week and a half ago, basically, you've received 6 fractions over that period of time.
Yes, sir.
And tell me what happened after the first treatment.
After the first treatment, immediately after, I didn't notice a lot of difference. But as the course of the day went on at work, I realized I'm using my arm more without feeling pain and saying, oh, I got to baby it. And then I tended to start overusing it because it didn't hurt anymore. And I'm at work and I'm trying to just get things done, you know how we are. But yes, I did notice, especially being able to sleep through the night, that was one of the biggest things, not being kind of tired all day because of tossing and turning at night because of the pain.
And you'd wake up how many times at night usually with pain?
Oh, at least 4 or 5 times.
Yeah.
I never felt like I got a completely restful sleep.
Okay. And so now you've completed all 6 treatments. Can I see your movement of your arm at this point in time?
Sure.
Now, before, how far out could you, okay, so do the movement of that arm. Okay, so could you do that before with no pain? Okay, no.
Not with my arm stretched out. Now,
Okay.
like this, I could probably reach a little higher.
Yeah. And see, let me see going straight up.
Like this?
And could you do that before?
No.
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 Not at all.
So that's a great improvement over what you had.
Yes. Yes.
And the pain at this level, what do you consider the pain at this
Probably
level?
if it's always been a jabbing pain.
Right, like a knife stabbing you.
Yeah.
Yeah. And
Now it's more of a duller, not as severe, not nearly as severe stabbing pain, but it's dull. It's not
Yeah.
sharp, and it doesn't last as long. And
kind of like you feel your joint is tight, and when you start to reach its limits, it starts to stretch your muscles that never got
very good.
stretched
That's
before.
exactly yes.
Okay. And so what level is the pain at this point, from a 1 to 10?
I would say before it was 9 or 10. Now 4 or 5.
Okay. And as
Not
you,
as often.
right, and as you sit there right now, talking to me, what's the level of pain right now? In
No
the shoulder?
pain.
No pain. Okay.
I wasn't able to use my shoulder. Wasn't able to blow dry my hair, tasks that you really take for granted. Driving my car, even a short distance from my home, presented really painful to me, to the point where I just was exhausted. Couldn't do any exercise. I was really, an avid, runner before, hiker. Couldn't do anything like that. Couldn't cook. So even just using, I'm right-handed, so working on the computer was extremely painful.
So what happened after the first treatment to the shoulder?
Yeah, so after the first treatment, I was really blown away by the positive results. So during the time prior to the first treatment, I literally couldn't move my shoulder beyond this point. So it was stuck like this. So this was prior to the first treatment. After the first treatment, I literally was able to move it straight up like this. And then as we progressed through the treatments, I was able to continue not only to move it up, but to then do even more things, such as being able to drive to the treatment center. So from where my home is, the treatment center is 45 minutes. So as time went on, not only was I able to drive here and drive home, but to be able to do errands and not to be able to have that electric pain. So with my condition, it was constant electric pain that would shoot up and down my arm, affecting doing things as going to the grocery store, going to get gas in my car. So simple daily activities were really, inhibited from this type of pain. In addition to that, as the treatments went on, which I had 6 treatments in total, I haven't been having this nerve pain. So the pain has really dissipated. Today's the first time in almost 2 years I've actually been able to blow dry my hair. I've had to let it air dry up for 2 years, which is something huge for me. I used to be able to blow dry my hair every day, and so just that motion of being able to do that before, I wasn't able to literally be able to just use that motion with a hairbrush. It was extremely painful. So things that you would just take for granted that you don't even think about, using my arm to just write or type on the computer, texting, things of that nature, really just lit up my arm in excruciating pain before.
You had treatment to your right shoulder,
Correct.
and the shoulder was giving you lots of pain, and you
Yeah.
couldn't do sit-ups like you normally do.
Push-ups, yeah.
Push-ups, yeah, push-ups. And so your push-ups, you normally do 200 a day.
200.
And not that I said you go out and do this after your first treatment,
Yes.
but after the first treatment, your pain had improved so much that you decided to try some push-ups. And how many did you do?
100. Yeah.
100. Okay. Okay. And now you've completed your treatment to the right shoulder.
Yeah.
And how would you call the level of pain and mobility?
I'd say at least 90% improvement. You know,
Okay.
but I would feel like my bones, like the way you crack your knuckles if I do this.
Uh huh.
Now I don't even feel that at all.
And the mobility? How about lifting above? Everything.
Yeah,
Everything.
everything's good. Yeah.
You couldn't go back before. I think that was your biggest problem, right? Trying to push it back here,
Yeah, like and this motion also it really hurt, like right in here.
right in there.
And now
Okay.
there's no pain when I
No
do
pain
this.
whatsoever.
Yeah.
Okay. Good. Good. He's going to receive his first treatment to his right shoulder. Let's see how far you can raise your shoulder before your treatment. This is, go ahead and raise the right arm. And then it starts to hurt right about there.
Right about here.
Okay, all right. And that's, okay, put that down. Let's see your left arm too.
That's a little better. Oh,
Right,
about here.
right there, okay, good. we're basically discussing his treatment to his shoulders and his cervical spine. He started treatment approximately a week and a half ago. He's received 3 treatments to the right shoulder, 2 treatments to the left shoulder, and 1 treatment to his neck currently. When he first came in, he couldn't raise your hands above your head without serious pain, right? So right now, just kind of give me a movement of where you are when your arms together when you start to raise them. Can you do that for us? Like that. So you can go up that high now,
Yeah.
and you couldn't do that before.
Correct.
Okay.